My name is Taylor Mobley. I will be discussing health concerns for caregivers of impaired adults. Many individuals find themselves taking on the role of a caregiver at some point in their life. There's many conditions that require an individual to have a full-time caregiver, such as Alzheimer's, dementia, MS, heart disease, physical impairments like quadriplegics, deaf and blind individuals, genetic conditions, birth defects, cancer, and other chronic illnesses. Caregivers are at increased risk for health disparities because the majority of their time goes to caring for another individual, which causes them to put their health and self-care on the back burner as they focus on meeting the needs of a care receiver. Locally in Weber County, 8.4% of individuals live with a disability, and most require a caregiver. In the state of Utah, 1 in 5 adults are caregivers. Nationwide, there's approximately 63 million caregivers. And as you can tell by this picture, Utah is one of the states with a higher percentage of caregivers. The higher percentage of those living with a disability in the state causes Utah to have an overall higher percentage of caregivers. Internationally, there's 100 million caregivers in Europe, 6.5 million in the UK, and 2.7 million in Australia. Nationally, there's a higher amount of caregivers in US when compared to other countries like your UK and Australia. However, Europe has more caregivers than the United States. Approximately 10% of the world's population has a disability. Factors like poverty level, healthcare, nutrition, sanitation, and living conditions contribute to a higher percentage of disability, disease, and mortality level. Increasing age and the increasing elderly population is now requiring more caregivers. So the combination of these factors require an increased number of caregivers. Several social determinants of health have the ability to prevent barriers for this population. Health and healthcare is the largest social determinant of health that presents a barrier for this population. Availability of resources could prevent a barrier for the caregiver. If the barrier is present, a caregiver can have trouble providing care to the person they are caring for. However, more importantly, the role contributes to more self-care deficits and can negatively impact a caregiver's health and previous health conditions. Financial concerns are another big worry for this population. Caregivers are often financially strained, which adds stress to their life. 35% of caregivers have had to quit a job, retire, work less hours, take a leave of absence, or lose a promotion because of the role. It's anticipated there will be many costly expenses associated with this role. Education level may also contribute to a barrier. Learning how to care for somebody or performing necessary procedures may prevent a barrier. Barriers can come from not receiving proper training or education and can also be contributed to a person's education level. Social determinant of health in the social context can also be a barrier. If caregivers do not use or take the support available to them throughout the community, their health can be affected. Examples of resources include respite care, social support, trainings, and other programs offered through the state or county or other organizations. The caregiving situation may cause a barrier with accessibility. This can cause stress and strain on a caregiver if their house is not accessible, and often there may be changes that are needed. Physical concerns for this population include exhaustion, fatigue, and poor health behaviors. Physical demands of being a caregiver requires the caregiver to experience exhaustion and fatigue. Poor health behaviors include poor eating habits, decreased physical activity, increased alcohol consumption, and smoking. Psychosocial concerns are caregiver burden, stress, depression, anxiety. One of the greatest difficulties reported by caregivers is stress. 88.5% of caregivers report stress because of the decisions that caregivers are faced with. There's a large amount of stress associated. Helping loved ones make serious decisions about their health and well-being causes caregivers to experience stress and anxiety. Economic concerns are another big concern for this population. The cost of caregiving to a person with a disability can be very costly. Many caregivers feel financially strained. Caregivers are often focused on meeting the needs of their care receiver and fall short of meeting their own needs. Root causes for this are stress, burnout, and physical exhaustion. This is an example of a 5 whys question. So, why is a caregiver feeling fatigued? Why are they only sleeping 3 hours in the night? Because they're up multiple times in the middle of the night. Why are they up in the middle of the night? Because they have to attend to needs of their care receiver. Why do they have to attend to needs in the middle of the night? Because they have meds or treatments to do. They don't want to hire out cares. Why do they not want to hire out cares? Because they feel guilty. Why do they feel guilty? Because they feel it's their job to provide care and they don't think they can afford hiring it out. So this is a common example of some of the frustration and concerns that caregivers are caused with and some possible reasons why they can have health concerns. When looking at Maslow's hierarchy of needs, physiological safety and love and belonging are the tiers that will most likely be met. Their basic necessities will be met, and so they can surpass the physiological tier. Their safety is usually met as they use resources available to them and try to maintain their health. However, there is a chance this tier can be unmet if they experience health disparities and complications. And oftentimes the love and belonging tier is met as they feel a sense of pride and worth as they provide care to their care receiver. The top 2 tiers would be more difficult for a caregiver to meet. With the physical demands of being a caregiver, they often fall short of meeting the requirements for esteem. Self-actualization is a hard one for anybody to achieve, but with a caregiver, the hardships and stresses they experience will likely cause them to fall short of this tier. Caregivers' functional levels are often declined with the higher levels of stress, anxiety, depression, and physical exhaustion they experience. And their physical health is likely to be affected by the demands of caregiving. They are at a higher risk for previous health conditions worsening due to the decreased care they provide in themselves. Individuals who are disabled or have a health condition are usually at a higher risk for communicable diseases or infections. Because of this, it puts the caregiving population at a higher risk of associating this. Some caregivers have to help their care receiver with procedures or cares, so it puts them at a high risk of acquiring an infection. It's important to educate them on ways to prevent acquiring these things, so good hygiene, protective equipment, teaching them about prevention and about illnesses, as well as maintaining a clean environment can be some ways they can prevent. Caregivers fall short of meeting their own needs. 42% of unpaid caregivers put the health of the person they are caring for above themselves, so they are at risk for their health conditions worsening. In Utah, 48% of caregivers admitted to the role aggravating their own health problems, so there's a risk for their health problems worsening, as well as a risk for them being diagnosed with more health problems because of the self-care deficits that they have. So lack of exercise, difficulty sleeping, weight gain, weight loss, smoking, alcohol dependence, and cutting corners on their personal health, as well as depression, can be some of the health issues that are affecting caregivers. The graph here shows chronic diseases and the percentage of caregivers that have chronic diseases. So you can see that Utah caregivers have a pretty high percentage of caregivers with 2 or more chronic diseases. So it's important we educate caregivers to prevent acquiring more or worsening their conditions by using healthy coping strategies like diet, exercise, and stress management, and using resources available to them. Caregivers are at a huge risk for self-care deficits. Caregiver burden, stress, and depression can be some of the things they experience, as well as self-harm. Because the role can be physically, psychologically, and financially exhausting, they can often feel a decreased quality of life. There's an article by Majestic and Eddington that recognizes the risk of self-care deficits and caregiver burden, and they suggest that caregivers set personal goals to help them maintain their self-care and prevent caregiver burden. When they set personal goals, it can help them feel more like themselves and lessen the psychological stress of being a caregiver. A risk of harm to or by others is a concern for this population. There's a risk of caregivers being harmed by the care receiver. For example, if a caregiver is caring for somebody with a severe psychiatric disorder, there's a risk of possible violence there. On the other hand, there's a risk of a caregiver harming the care receiver, like abuse or neglect. Family caregivers are at a higher risk of increased levels of hostility, which can add to an increased risk of harm. Harm can be prevented by trying to prevent caregiver burden and exhaustion associated with this role. If caregivers take part in community resources available to them, they can help them learn coping strategies and have an outlet to caregiving. Here are my references for this slide. Thank you.